Hi, my name is Jennifer and I'm a student nurse at Glacier Hills Senior Living in the Care and Rehabilitation Center. I'm going to present a patient to you. The patient is an 80-year-old married African American male. His former job was a physical education teacher. He is now retired and living with his wife of 54 years, financially supported by Medicare. The patient has been under the care of Glacier Hills for the past 8 days since Monday, March 10, 2014. The patient's vital signs are a blood pressure of 150/95, a respiratory rate of 25 breaths per minute, a pulse of 98 beats per minute, and a temperature of 98.6 degrees Fahrenheit. Chief complaint. The patient's chief complaint is chest pain related to congestive heart failure. History of present illness. The patient has had a recent heart attack, but also has coronary artery disease. He experiences continual shortness of breath, but reports increased difficulty in the mornings. The patient additionally suffers from hypercapnia, which is excessive carbon dioxide in the bloodstream, a result of his inadequate respiration. He uses an oxygen tank to alleviate his shortness of breath along with hypercapnia. The patient is in chronic renal failure, has hypertension, hypothyroidism, and pulmonary edema. The patient also suffers from dementia. It is important for me to note that due to his dementia, the patient is a poor historian and some information provided may be incorrect. The patient states that he discovered his illness when he was not looking for it, about 1 month prior to date. Health history. The patient reports he was a healthy child, teenager, and adult, and that he has been in pristine shape his entire life. He reports that during late adulthood he suffered from frequent seizures approximately 3 times per day. He reports that these seizures have recently stopped within the past year. He contributes these seizures to being diagnosed with epilepsy. However, there is no medical record of him having this disorder. The patient reports he did not receive a flu or pneumonia vaccine. The patient denies any allergies or drug reactions. However, it was noted on his chart that he has an allergy to the medication Lipitor. Patient denies any past surgeries. Functional assessment. The patient denies drug or alcohol use as he does not smoke or consume caffeine. He reports adequate exercise every day due to his grandson who is persistent and encourages him to remain active. He reports sleeping well throughout the night, accompanied by the occasional inability to sleep. He states that his nutrition is adequate but not ideal, contributing this issue to the hospital food. He is not allowed to walk on his own and must always be assisted by a staff member. When assisted, he sometimes uses a walker to help him remain balanced. There is a security system set in the patient's room that alerts the nurse if he tries to walk on his own. Psychosocial data. The patient reports that he currently lives in Pasadena, California, Chicago, Illinois, along with New Orleans, Louisiana. He additionally reports that he attended and graduated college in New Orleans, majoring in physical education. He reported being widowed, but also reported that he currently lives with a wife a few minutes after. He has one grandson who reportedly visits often. The patient receives his motivation to improve from his grandson, and he wants to set a good example for him. Family history. The patient denies any family history of heart disease. He also denies any illness in his immediate or extended family. Review of systems. General. The patient describes himself as healthy. He reports that he was doing well up until receiving his diagnosis of congestive heart failure. He is aware of his high blood pressure. He reports an unplanned weight loss accompanied by a low energy level. He contributes his weight loss to being constrained to his hospital bed and reports losing approximately 50 pounds. The patient denies experiencing a fever, but reports daily chills and night sweats about every other day. He denies excessive fatigue and reports that his low energy level does not interfere with his usual activities. The patient denies heat or cold intolerance. High priority system, system number 1, lungs and thorax assessment. Given the patient's complaint of shortness of breath, a diagnosis of pulmonary edema, it is important to perform a respiratory assessment. The patient denies a history of pneumonia, bronchitis, or asthma. The patient's AP transverse diameter is 1:1, he is barrel-chested, his thorax is symmetric, and has no apparent injuries. He presents with dyspnea, an increased respiratory rate, shortness of breath, especially upon exertion, orthopnea, peripheral edema, and pallor of the skin. Patient denies pain with breathing, but reports that his chest feels occasionally tight. Patient reports frequent dry coughing, but states that it does not interfere with his daily activities. Patient denies frequent upper respiratory infections. Upon palpation, no tracheal deviation was present. Posterior expansion was bisymmetrical. Posterior tactile fremitus was normal. Skin was cool and clammy. Upon auscultation, all lung fields presented with decreased breath sounds, indicating low velocity airflow. Wheezes and crackles were present at the posterior and lateral bases of the lungs, indicating moisture in the airway. Bronchophony, agophony, and pectoraliquy were positive, indicating fluid in the lungs. Fluid may be contributed to patient's prior heart attack, congestive heart failure, or kidney failure. High priority system, system number 2, cardiovascular assessment. Due to the patient's diagnosis of congestive heart failure and high blood pressure, it is necessary to perform a cardiovascular assessment. This patient has left-sided heart failure, causing blood to pack up into the pulmonary system. The patient denies chest pain and arm or jaw numbness. He states that occasionally he feels discomfort in his chest, but is unable to distinguish whether it is caused by heart pain or gas. Patient denies a history of heart diseases, hypertension, or murmur. Patient denies a change in exertion tolerance or excessive fatigue. Patient states he can walk about a mile without becoming distressed. The patient denies any difficulty lying flat and sleeps with one pillow. The patient denies any palpations. Upon inspection, no heaves or lifts were present over the 5 key areas. A 7-inch raised scar was present down the middle of the chest, beginning in the center of the scapula. Patient reports this scar was the result of an umbilical hernia. Medical records indicate scar is due to past open heart surgery. Upon palpation, no lifts or thrills were present over the 5 key areas or PMI. Upon auscultation, S1 and S2 heart sounds were both present, a normal finding. An abnormal S3 heart sound was detected in the pulmonic area. This indicates a failing left ventricle due to the patient's congestive heart failure. Pertinent systems, system number 1, neuro. According to an article of the Journal of Pain and Symptom Management, observations of facial expressions and vocalizations are accurate means for assessing the presence of pain in patients unable to communicate verbally because of advanced dementia. Pain represents a major treatment challenge in older people with dementia. Due to the patient's past diagnosis of dementia, it is important to assess his neurological status because recent work has provided evidence that untreated pain may be a major contributor to reduced quality of life and also increases the likelihood of emergence of behavioral and psychological symptoms such as agitation. If the patient's neurological assessment shows decreased neurological ability, alternative methods of determining pain and pertinent information will need to be taken. Better assessment and treatment of pain may substantially improve outcomes for people with dementia. Pertinent system, system number 2, peripheral vascular. People are at higher risk of developing peripheral artery disease if they have a history of abnormal cholesterol, coronary artery disease, kidney disease, and smoking. Due to the patient's diagnosis of congestive heart failure, along with these comorbidities, it is important to perform a peripheral vascular assessment. According to the journal titled Cardiology in Review, patients with peripheral artery disease have an annual mortality rate of more than 5%, mainly caused by coronary artery disease. The annual amputation rate is approximately 1.4% in unoperated cases. Nearly 40% of patients referred for peripheral artery disease surgery have angiographically significant coronary artery disease. Patient's medications. The patient is currently on a low-sodium diet. He takes 50 milligrams of Synthroid orally for hypothyroidism. It increases basal metabolic rate, increases utilization and mobilization of glycogen storage, promotes gluconeogenesis, and it is involved in growth development. This may contribute to the patient's night sweats. The patient takes 20 milligrams of Pervastin orally at bedtime for hyperlipidemia. Pervastin decreases the production of LDL cholesterol by blocking the action of the enzyme in the liver that is responsible for its production. This decreases the amount of cholesterol in the liver cells, causing them to take up LDL cholesterol from the blood. The decreased cholesterol production and increased removal of LDL from the blood ultimately results in lower blood cholesterol levels. The patient takes 25 milligrams of sertraline orally as an antidepressant. This medication works by preventing serotonin from being reabsorbed back into the nerve cells in the brain. This helps prolong the mood-lightening effect of any released serotonin. In this way, serotonin helps relieve depression. The patient takes 500 milligrams of calcium and vitamin D orally. The patient takes 5 milligrams of benzapril orally for hypertension. It competitively inhibits angiotensin-converting enzymes, resulting in decreased plasma angiotensin II concentrations, thus reducing blood pressure. It also increases renin activity and decreases aldosterone secretion. The patient takes 3.125 milligrams of Coreg for hypertension, as well as a left ventricular dysfunction following a myocardial infarction. It is a beta blocker which lowers heart rate. The patient takes 80 milligrams of Lasix for edema associated with congestive heart failure and renal disease. It is a diuretic which inhibits the reabsorption of sodium and chloride ions at the proximal and distal renal tubules and loop of Henle, causing increases in water, calcium, magnesium, sodium, and chloride to be excreted. This extra fluid is pulled off from the lungs or peripheral vascular extremities. He takes 25 milligrams of quetiapine orally at bedtime for insomnia. It is an antipsychotic which works by blocking the receptors in the brain that dopamine acts on. The patient takes 81 milligrams of ASA for angina. It is also used as a regimen to prevent heart attacks in people who have had a previous heart attack, as well as to reduce the risk of death in people who are experiencing or have recently experienced a heart attack. He takes 75 milligrams of Plavix for coronary artery disease. This inhibits platelet aggregation. The patient takes 0.4 milligrams of nitroglycerin sublingually as needed for angina and renal failure. This causes venodilation, increasing preload of the heart. It also helps to lower blood pressure.